We see cases of Group A strep every year, especially among young children. Group A strep's a common bacteria that many of us carry on in our noses, in our throats and in our skin. And what we're seeing this year in terms of the numbers of children with Group A strep isn't unusual. It's the time of year that's unusual. This year Group A strep is circulating at the same time as other viruses that cause similar early symptoms. It's understandable that parents are worried, and it's really important that children get the right care in the right place, whether that's self-care at home, help from the GP with antibiotics, or if need be, hospital care. What's really important is to know what symptoms to look out for. And if your child has a sore throat and a runny nose, it's unlikely to be Group A strep, and they can be cared for at home with paracetamol and plenty of fluids. And if you do need some advice, your local pharmacy is the best place to get that. Group A strep almost always causes mild symptoms, but in rare cases it can get into the bloodstream or into the lungs and cause septicemia or pneumonia, and it's really important that it gets treated early with antibiotics to avoid complications. You should contact NHS 111 or your GP if you believe your child has got scarlet fever, and that's a rash that can feel like sandpaper, and it can actually be more difficult to see on darker skin, but it still feels like sandpaper. Another time to go to the GP or speak to NHS 111 is if your child's got a sore throat that's so serious that they're unable to eat and drink. You should also contact your GP or NHS 111 if your child has got a sore throat, headache or fever, and is eating and drinking much less than usual, is dehydrated, and that can mean not had a wet nappy for 12 hours if in a baby, if they are tired and irritable, and if they've got a really high temperature, so that's 38 degrees in a baby 3 months and under, or 39 degrees in a baby over 3 or child over 3 months. It's important to call 999 or go to A&E if your child is having difficulty breathing, and you may notice grunting sounds or the tummy sucking under the ribs, or if there are pauses between breaths when your child breathes, or if your child's skin, lips or tongue are blue, or if they are floppy and won't wake up or stay awake. It's important to prevent these bugs spreading, so encourage children to wash their hands properly for 20 seconds with soap and water. Keep them away from other people if they're unwell, and encourage them to cough and sneeze into a tissue.